All right, this will be the third quiz for the anterior side lower extremity. Just like the other ones, we'll go through, we'll ask all the questions, pause if you need more time. When we're done asking the questions, you can pause, go over your answers, and then when you're ready, start the video up again. We'll go over the correct answers together. All right, let's start. Number one. Move over here. So we're going to be up in the abdomen for this one. Just move this out of the way. Open this up a little bit. All right, so up in the abdomen, right here, we have two muscles. We have this one that we can see that sits on top, and if we move that out of the way, I want you to identify the muscle that's right underneath of that one, right here. That's number one. Identify that muscle there. Number two, we're going to move down onto the anterior thigh. So we're going to take this fascia here, we're going to open this up. I'm going to lift up this muscle here. If we follow this muscle down, we can see we have two different muscles that join it. I want you to identify the one that's on this side, right here. Identify that muscle right there. That's number two. Number three, we're going to move over here to the medial thigh. So I'm just going to move this out a little bit there. And in this area, right, we have 1, 2, 3, 4, 5 muscles. Of those, I want you to identify first one right here. Identify that muscle. That was number three. Number four, we're going to come down here. We're going to be on the anterior leg now. So I'm just going to turn this out a little bit like that. And you can see we have this fascia here that we can move out of the way, and we uncover these muscles. So we're going to just open this area up a little bit, and we want to identify this muscle, the one I'm moving right there. So you can kind of see it if I move this out of the way. Identify that muscle, and if we follow it down, it goes to this tendon to here. That's number four. Number five, we're going to come down, same area, but we're going to follow that muscle down to the top of the foot, right? And just next to that, you see we have another tendon right here. And if we follow this back a little bit, move, oops, if I can get under here, we're going to move this out of the way. Oh, how am I going to do this here? Hold on a second. Switch hands. There we go. So we're going to take this, move that out of the way. And I want you to identify this muscle that we uncover right here that goes to this tendon, right? So we can kind of see the muscle right there to that tendon to here. So that muscle right along there. That's number five. Number six is we're going to come over here and we're going to spread apart these muscles here. So we're going to move this one that we just asked about before. We're going to take that, move it out of the way. Let's see if I can loosen this up a little bit. So we're going to open up this area, and in there, we want to identify this vessel right here. That one there. Now notice that there is another one in here. This one, right? Not that skinnier one, but this, if I can get under it again. There you go. That thicker one there, that vessel right there. That was number six. Number seven, we're going to come back up to the medial thigh here. So just move this back out a little bit, right? And again, in this area, we had 1, 2, 3, 4, 5 muscles. Of those, we want to identify the second one that I'm outlining right here. That muscle. That was 7. Number 8, in the same area, we're going to go in between the first and the second muscle here. So we're just gonna kind of spread these muscles apart just a little, like that. And here we have a vessel that is emerging right in between and deep to those two muscles. I want you to identify that vessel right there. That's number 8. Number 9 is here. So we're gonna come up to this area. So we kind of got 1, 2, 3 vessels there, right? That we can kind of highlight like that, right? So in this area, we got 1, 2, 3 vessels. We're gonna stay on the middle one here, right? So I'm gonna lift up like this, and here we can kind of see a split like that. And we can do it on, actually you can do it your way like that, it's fine, right? So we can see if I hold this up, we can see this split here. If we follow it down a little bit, we can see we have a branch going towards you there, right? And if we move this over, we got a branch coming towards me here. And we want to identify this branch right here. Both of those, it splits a little bit, but that whole thing, it's coming towards me there. Identify that vessel. That's 9. Number 10, we're gonna go back down to the anterior leg, move down here, back down to this area, right? So if we kind of spread that apart, we kind of had 1, 2, and then we have 3 and 4 muscles connected here. The third and the fourth one are connected. If we follow it down, we want, of those 2 muscles that are here, we want the one that goes to these tendons here. Those tendons, and if we follow them out, it attaches here, 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 here. So of the 2 muscles that are located right here, the ones that go to these tendons to here, 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 that muscle. That's number 10. Number 11 is we're gonna come back up here to where we had 1, 2, 3 vessels in this area, and we want to identify this one that's right in the middle here, this whole thing, right? This vessel that we see right there. That's number 11. Number 12, if we follow, and I think for this, why don't you switch me? You don't want to look that way. And that number again, 12, yeah. For number 12, if we follow 11 farther down, so we can see here's 11, this is what we were just asking about. Now we're gonna follow this more distally. I'm gonna take this muscle and lift it up a little bit, and we can see this vessel. We can follow it a little, actually, maybe we'll go this way. So we can see that vessel there. We can see that vessel again here. It travels underneath of this muscle. And then right here, we can see I can push the probe. We're going into a pocket right there. So that vessel travels into a pocket. And I want to know what the name of this pocket is here and what the name of it is when we exit on the other side. All right, so the name of this pocket that we can see the probe going into here, and then the name of that pocket as it exits on the posterior side. All right, both of those for number 12. Both of those for 12. All right. Number 13 is, if I'm gonna go back up here, right? So we're gonna go right back to that same vessel that we had asked about before, the one that was in the middle, right here. And I wanna know what is the name of this vessel when it's still inside the abdominal cavity. So this vessel undergoes a name change as it passes under this ligament here, going from inside the abdominal cavity to outside. And I want to know what it was called inside the abdominal cavity. That vessel inside the abdominal cavity. That was 13. Number 14 is we're going to come back down here. We're going to go back to that same vessel we were just on again. And here, again, I can take this, I'm going to move it over. We can see where we have this branch here. So I'm holding this vessel. We got this branch that's diving deeper, right? And if we kind of move this stuff one way or the other, you can see here's a branch going towards you, right? And here's a branch coming towards me, and I want to know what the one coming towards me is called, right here. That was 14. Number 15 is down a little farther. So we're going to come all the way down here towards the ankle, and I want to know, what is this bony process sticking out on this side of the ankle called? Right there. And just make sure you can kind of see, like, back out a little bit so you can see like the foot and what side of the foot we're on. Right? That bony spot right there. All right. And that was 15. Number 16 is here. So if I grab the fascia, right, that covers over this area, I want to know, what is the special name we gave to this whole piece of fascia here? It covers that area. Name that fascia. That's 16. Number 17 is to identify this superficial vessel that we can see here, right? So you can see it all along the thigh, you can see it down here along the leg, and you can see it continuing towards the top of the foot down there, that whole thing. Identify that vessel there. That was 17. Number 18, you're going to go back and name one movement that number 7 could perform. One movement that number 7 could perform. And number 7 was going to be this muscle here. This is one we already identified. That muscle there is number 7. Name one movement that muscle can perform. That's number 18. Then for 19, you're going to name a muscle that's antagonistic to number 7 based upon the movement that you just named that number 7 can do. All right? So name a muscle that's antagonistic to 7 based upon the movement you put for 18. That will be for number 19. And then number 20 is going back to this vessel that we identified, this whole superficial vessel here. I want you to tell me, what is the most common clinical use for this vessel here? And that would be for number 20. Okay, that's all the questions. So pause if you need more time. When you're ready, hit play again and we'll go over the correct answers. All right, so going over the answers. Number 1, we were up inside the abdomen and we had these two muscles here, and we wanted to know if we took this one and moved it out of the way, the one that's under, that would be psoas major. So this tendinous part here is part of psoas minor. Move that, the rest of it there, psoas major. That's number 1. Number 2, we're down in the quads. So we kind of took this fascia, opened it up, and we wanted to know what this muscle was over here, this one of the quadriceps, and that is vastus medialis. Number 3 was in the medial thigh muscles here. So we'll move this over, right? Of these muscles, we wanted to identify the very first one for number 3, and that is pectineus. Number 4, going down to the anterior leg, came down here. We kind of spread these muscles apart a little bit, and we wanted this second one, the one we're moving right there. Followed it down to this tendon to here. That's extensor hallucis longus. Then for number 5, we came down to the top of the foot and we wanted the other muscle that also goes to the hallux here. And that shorter counterpart that's located on top of the foot, that we can kind of see there, and that's going to be extensor hallucis brevis. Then number 6, we came down here, anterior leg. We kind of loosened this a little bit and just opened up these muscles here. So we're spreading apart tibialis anterior and extensor hallucis longus. We kind of opened that up, and we wanted to identify this vessel that's kind of deep and in between those muscles, and that is going to be your anterior tibial artery and vein. Now, I had indicated that there's another vessel in there, if we can get it. Let's see, open this up a little bit right here. This guy. This skinnier one is a nerve. That's going to be your deep fibular nerve that you're going to want to associate with the anterior tibial artery and vein. But the one we had asked about, anterior tibial artery and vein. That was 6. Number 7 is to come back up to the medial thigh muscles and to identify the second one of the medial thigh muscles, this guy, which is adductor longus. Number 8 was if we went in between the first and the second muscles here. So in between pectineus and adductor longus, we kind of get in between those guys a little bit like this, and to identify this vessel that is emerging from in between those two, and that is going to be your obturator nerve. That was 8. Number 9 was to come up here, and we went right here, and we have these 3 vessels emerging, which is your femoral nerve, your femoral artery, femoral vein. We were on the femoral artery, right? So we kind of grabbed the femoral artery, moved it over. You can see this first split here, which is where we have femoral artery continuing, we have deep femoral, and then off of that we have a branch going laterally, and on the other side, one going medially, and we wanted the one going medially right here, which is going to be your medial femoral circumflex artery. And that's going to be both of those branches. Splits a little bit, but both of those things. Medial femoral circumflex. That was number 9. Number 10 is back down the anterior leg, was down here. It was in this area, right? We have 1, 2, 3, 4 muscles. The third and the fourth are kind of joined together over here. This muscle that we're moving there. Follow it down, and we wanted to know what this part of it is called. If I can get it right there. That goes down towards digits 2, 3, 4, 5, and that is going to be extensor digitorum longus. That part there, extensor digitorum longus. Number 11 was back up here, and of the 3 vessels that emerge here, we just want to identify the middle one, which is going to be your femoral artery. That was 11. Number 12 is, and we kind of showed this from this side. Let's just switch real quick. So we follow 12 down farther. So we follow that femoral artery down. It passes under sartorius. We can see right here where it's still underneath of sartorius, right? And we wanted to know what was this opening that we're traveling into there. So the femoral artery goes into an opening here. That's called the adductor canal. And then the name of that, when it emerges on the posterior side of the thigh, is the adductor hiatus. Number 13 was to go back to the femoral artery. So we're here. I kind of highlighted the femoral artery again, and I said I want to know what this vessel is called when it's located inside the abdomen, and that would be your external iliac artery. So this same vessel, if we pass under the inguinal ligament and we are inside the abdomen over here, external iliac artery. As soon as it passes underneath the inguinal ligament, femoral artery. Number 14 was back on these arteries again. So we grabbed the femoral artery, lifted it up. We could see femoral and deep femoral right here. And then when we move that one way or the other, we have that vessel going medially, which is, we already answered, which was medial femoral circumflex artery. And if we move it over this way, the one that we're asking about here is this branch going laterally, which is your lateral femoral circumflex artery. Number 15 was down by the ankle joint. It was to name this bony feature that's sticking out on the medial side of the ankle, and that would be the medial malleolus of the tibia. Medial malleolus of the tibia. That was 15. Number 16 was to name this fascia that covers over the thigh here, and this is going to be the fascia lata. That's what covers over there. Number 17 is to identify this superficial vessel that we can see here, and that is going to be your great saphenous vein. Number 18 was named one movement for number 7. Number 7 was adductor longus. Want to name one thing that adductor longus can do? One of them's in the name. You could say adduction of the thigh or the pelvis at the hip. That's one thing. The other thing that adductor longus can do is external or lateral rotation of the thigh or the pelvis at the hip. Then for 19, we wanted a muscle that's antagonistic to adductor longus based upon the movement that you picked. So if you had picked adduction for adductor longus, then we need something that does abduction, and that would be either gluteus medius or your tensor fascia latae muscle, right? Either one of those would be a hip abductor, and that would be antagonistic. Now, if you had picked external rotation for adductor longus, then you need something that does internal rotation. So you could have picked gluteus minimus, you could have picked gracilis, something like that. You could have picked semimembranosus, semitendinosus, one of those. All of them would do internal or medial rotation of the thigh or the pelvis at the hip. So any one of those. It depends on the movement you picked, and then for the antagonistic muscle, you would have to go with the opposite of whatever movement, a muscle that can do the opposite of whatever movement you had chosen. All right, that's all for number 19. And then for number 20, we wanted to know what is the most common clinical use for this superficial vessel, which is that great saphenous vein. And this would be the vein, especially up here along the thigh, that gets harvested to do coronary bypass surgery. So if you want to replace a damaged coronary artery, you're going to take out this sections of this vein and use this to replace a damaged artery in your heart. That would be for 20. And that's it.